Hi everyone. Today I am going to talk about the cervical cancer vaccination. But before going to the main topic, you must know few things. Most of the cancers are caused by genetic disturbances, genetic changes in the body. It can either start in your own body or it might be inherited. But only 50 to 20% of the cancers, like that of cervix, cervical cancers, stomach cancer, liver cancers, are caused by infections, and that's why we have developed a vaccination against this human papilloma virus which causes our cervical cancer. And the next question is how this virus cause cancer. These virus, they transmit their own genetic material into our own body cells, and our cells get totally disturbed and goes out of control, and that's how the cancers develop. Next thing is, what is the source of this HPV virus? How you will get this HPV infection? Who are at high risk of this HPV infection? Generally, this HPV virus is transmitted through intercourse. And yes, if you have multiple sexual partners, you are at high risk of cervical cancer. And the second thing is smoking. Third one is low socioeconomic status. And the fourth one is intercourse at a very early younger age. Then also you are at high risk of cervical cancer. And number five is the immunodeficiency conditions like that of HIV. So all these people are at high risk of this HPV infection. Generally, most of the women are able to clear this HPV infection on their own, but few are unable to clear, like these of high risk categories, and these are at high risk of cervical cancers. And once you are affected with HPV infection, it takes minimum of 10 to 15 years to develop into a cancer. And here is how our screening helps. And regarding the screening, I'll be talking in the next video. This cervical cancer vaccine gives 100% protection against this genital warts and 70% protection against the cervical cancer, because HPV virus has lots of strains which can cause cancer, but we have vaccines against only few major strains which can cause cancers and not against all the strains. Coming to FAQs, number one is, at what age the vaccine is recommended? You should take the vaccine from 9 to 26 years of age before your first intercourse. But still, you can take till 45 years of age even after intercourse also, because you won't be affected with all the strains at the same time. There are lots of strains of HPV virus, but you might be only affected with few strains, and this vaccine will definitely help you against the strains which you are not already infected with, but will not protect from already existing HPV infection. Number two is, what are the types of vaccine? There are three types. One is cervarix. Cervarix vaccine will act against two strains of HPV virus. Number two is Gardasil. It acts against four strains of HPV virus, and there is also an added advantage of protection against genital warts. And number three is Gardasil 9. The name itself says that it will protect against 9 strains of HPV infection. This Gardasil 9 is a recent one. We have not yet started giving this Gardasil 9 vaccine. So we generally give this Gardasil vaccine. So number three is, what is the recommended schedule for this vaccination? For Cervarix, the recommended schedule is at 0 at 1 month and then 6 months. Whereas for Gardasil, the schedule is 0 at 2 months and then at 6 months. But for children below 15 years of age, only 2 doses are sufficient. One is at 0 and another one is at 6 months. And number 4 is, can it be given during pregnancy? No, we don't advise vaccine during pregnancy, but if you have conceived during your vaccination schedule, will not give you the next doses, but you can take post delivery. And number 5 is, will the vaccine give protection after intercourse? Yes, this already I have explained you. Even you had intercourse, you might not be affected with all the strains, so this vaccine will definitely protect you against the strains which you are not already infected with, but not give protection if you have already existing HPV infection. And number 6 is, should I continue screening even though after taking the vaccination? Yes, you should continue screening, because this vaccine will not give protection against all the strains. It gives protection only against few strains. So definitely screening is a must. Number 7 is, are there any side effect for this vaccine? No, absolutely there are no side effect for this vaccine. And number 8 is, can males take the vaccine? Yes, male should even take the vaccine from 9 years of age, because this vaccine will protect against this anal cancers, oropharyngeal cancers, that is mouth and throat cancers, as well as head and neck cancers, but only Gardasil can be given. Thank you.